Welcome to today's Deep Dive. You know, you probably brush off a severely tight neck or like a sudden bout of blurry vision as just the cost of doing business.
Right, people just chalk it up to normal stress.
Exactly. But today we're looking at clinical wellness videos and a really detailed patient case study. And it turns out those are actually anxiety's favorite hiding spots.
Yeah, your body's essentially screaming for help before your mind even registers the level of stress you're carrying.
Which brings us to our mission for you today. We want to uncover how mental stress transforms into intense physical symptoms and how to actually restore your balance using acupuncture and acupressure.
Because we so often view those physical symptoms in isolation,
Right.
But the sources show acupuncture is commonly used for 5 major things.
Right. So we're talking chronic pain, stress, tension migraines, insomnia, and nausea, even for patients going through chemotherapy.
Yeah, it's incredibly versatile.
But I do have to push back a little on the mechanism here because, okay, if chronic stress is like leaving your car engine redlining all day, isn't sticking a needle in a tight shoulder basically just, I don't know, putting tape over the check engine light?
I mean, it would be if it only offered localized relief. But what's fascinating here is that the needles actively communicate with your autonomic nervous system.
Wait, so it goes deeper than just relaxing one muscle?
Exactly. It stimulates sensory nerves right under the skin and in the muscles, which sends a direct signal to the brain. This flips your system out of that redlining fight-or-flight mode.
Oh, and puts you into the rest and digest mode.
You got it, the parasympathetic mode. It forces the brain to change the signals it sends to the whole engine.
So you get a release of all those feel-good chemicals then?
Yeah, a systemic release of endorphins, dopamine, and serotonin. It's a structural dampening of the body's stress response. It even helps regulate melatonin production.
Which directly combats the insomnia you mentioned earlier.
Right.
Wow. But, you know, when you ignore that check engine light, the stress doesn't just dissipate, it migrates.
It always finds a new spot.
Yeah. And that brings us to Kory, the patient in our case study. For him, this systemic overload eventually manifested as a complete loss of physical equilibrium. Basically, severe vertigo.
Which is terrifying. I mean, it's not just standard dizziness, it's this intense, false sensation of spinning like you're standing on a rocking boat.
And vertigo has multiple origins, right? Like nerve compression in the neck.
Yes, cervicalgia. Or it can stem from inner ear issues like BPPV.
Right, where the tiny calcium crystals in your ear get dislodged and just totally scramble your sense of balance.
Exactly. And in Kory's case, these severe vertigo flare-ups were triggered directly by intense work pressure.
Here is where his treatment trajectory gets really interesting, though. He started with crisis management.
Right, receiving acupuncture twice a week.
But then, as his nervous system stabilized, his treatment actually shifted to proactive prevention. So he was only going once every 3 weeks.
Which is a huge shift.
Definitely. But modern medicine obviously has specific fixes for vertigo, right? Like the Epley maneuver to physically reposition those ear crystals, or vestibular rehab to retrain the brain?
Yeah, absolutely.
So where does acupuncture actually fit alongside those targeted therapies?
Well, it addresses the underlying environment. By lowering that baseline autonomic nervous system overload, it prevents the conditions where stress-induced vertigo thrives in the first place.
Oh, so it lowers the water level, so to speak, complementing the medical maneuvers.
Exactly. It also reduces severe muscle tension in the cervical spine.
Okay, but let's be real. Not everyone can just step out for an acupuncture session in the middle of a high-stakes work meeting.
No, definitely not.
Thankfully, the sources detail some immediate do-it-yourself acupressure tools you can use right on the spot.
These are still practical.
Yeah, like pressing yin-tang.
Yes.
That's the point right between your eyebrows. It basically acts as a physiological Control-Alt-Delete for acute anxiety.
And the mechanism behind that is really compelling. That point sits right over the trigeminal nerve.
Okay.
So applying pressure there sends a signal down the vagus nerve, which actively forces your heart rate to slow down.
So it's literally a manual override for your nervous system.
Pretty much, yeah.
Then there's Shenmin, located on the upper ear. The sources describe it as a bouncer keeping emotional tension out.
I really love that analogy.
Me too. And finally, if you need to calm your mind instantly, you can press Ep.6. That's about 3 finger widths down your inner wrist.
Right, and you pair that with a 4-2-6 breathing pattern.
So inhale for 4 seconds, hold for 2, and exhale for 6.
Exactly. Pressing that wrist point stimulates the median nerve, which again engages that parasympathetic calming response.
And the breathing.
Well, Combining it with extended exhales mechanically lowers your heart rate. You're giving your body undeniable physical proof that it is safe to power down.
We've traced how unchecked mental pressure literally throws you physically off balance, and how these ancient techniques help you find steady ground.
Because, as Kory's case demonstrates, the body communicates entirely in the language of physical symptoms.
Right. We've talked a lot today about what to do when your body screams at you with vertigo or a stiff neck.
Yeah, it's powerful stuff.
But it leaves you wondering if acupressure can instantly alter our nervous system from the outside. What everyday physical habits are we doing right now that are secretly sending the exact opposite signals?